Hello, everybody, and I hope you're doing well. So, today we are going to be starting a new series. Basically, it's about health awareness, and I'm joined by Dr. Sudarshan, who's a diabetologist and a general physician. Now, for me, I am so grateful to you to have joined this initiative, and I'd really like you to introduce yourself to our viewers.
Thank you, Sneha, for inviting me for this program because awareness plays a very important role. Nowadays, people have a lot of misconception about diabetes and a lot of myths about diabetes. So that has to be busted, and the awareness plays a very important role. And myself, I'm Dr. Sudarshan. Hello, everyone. I'm a diabetologist and a general physician, and I'm working in Vruksho Clinic close to Kotanur by Rati Cross. And I was working previously in Shankara Cancer Hospital and Manipal Jainagar.
Okay.
So previously I worked in various organizations. That was my previous thing.
Mm-hmm.
So I'm more passionate about changing the lifestyle of people
Right.
to control the sugar than putting them on more medications. So my goal is to use as minimal or no medications. That's what I usually focus on. Of
Mm-hmm.
course, both side has to be cooperative. So
Yeah.
they have to implement. People have to implement whatever we discuss. So I try to make them understand why they have to do something what we suggest.
Right,
So and
right.
then from there we take the journey of
Oh, great.
diabetes.
In fact, I want to tell you all that I think it was last month I met Dr. Sudarshan for the first time, and we were there for a regular checkup. What really made me feel comfortable was that he had patience, number one. Because these days I've met a lot of health experts. They may be very good in what they're doing, but they don't have patience. Some of them, I'm not blaming the entire, community. He had a lot of patience and he educated us. देखिए मेडिसिन देने में there's no problem. People can keep giving us medicines, we can keep taking it also, but if we don't know why are we taking it, what is the issue, there's absolutely no use. So that is when I really wanted him to join us in this conversation. So doctor, I have a huge list of questions for you.
Shoot.
So let me start with, what is diabetes?
Okay. See, coming to diabetes, diabetes is something where your body is not able to metabolize your sugars, whatever is produced in your body, whatever you consume, and all those productions. So many things will be happening. So main thing here, what we have to understand is there are different kinds of diabetes.
Mhm.
Okay. So main thing it's a syndrome. Okay. So different kind means so more common thing is type 1, type 2, and GDM, that is gestational diabetes. These three are very
Okay.
common. There are many other types. Let us not go deep into that.
All right.
Type 1, which we diagnose in childhood. So when the kid is born, it will be born with the deficient of pancreatic cells.
Okay.
So the body is not able to produce insulin in the body. So early diagnosis will happen. Maybe at 5 6 years they'll come to know baby is diabetic, and they have to supplement with the insulin. They have to give injections lifelong. As of now, a lot of research is going on through that also. So there is type 1 that we can't do means okay, lifestyle plays a very important role, but of course the insulin has to be given injection wise as of now.
Mm-hmm.
Then type 2 is very important, which we see very common in nowadays in India. We are capital of diabetes in the world, so we need to focus on that because more it's a lifestyle disorder.
Right.
So the lifestyle disorder means like our lifestyle, we know nowadays what kind of lifestyle we are undergoing. So lifestyle disorder. So that is type 2 plays a very important. It's a major chunk of diabetes. And gestational diabetes nowadays I'm seeing very common because all pregnant ladies who are not diabetic, their sugars goes high during the pregnancy time. So that is a different kind of management. So that has we have a different kind of goals for that, and we do a different kind of treatment for that.
Got it.
Yeah, but first I feel to know more is about type 2 diabetes, which
Okay.
is very important.
Yeah, yeah, I think you're right because any friend I meet, most people, relatives, it's type 2
Exactly.
diabetes, and I completely sort of understand it's because of our generation, the way we
Yes,
are doing
yes.
things.
Correct.
So that needs to be changed, I guess.
Exactly. Exactly.
So
Agree.
now, what is the risk of diabetes?
See, the risk factors for diabetes are plenty.
Hmm.
The first thing now, before maybe 15 years back, if you see in my clinic, there will be only old people. Nowadays I see all kind of age, means type 2 diabetes I'm talking
Yeah,
about.
there are
The
kids also, I
Yeah,
think.
that's type 1. So
Okay.
now the recent type 2 diabetes, the earliest stage what I saw was 20. So
Oh.
that early type 2 diabetes can start. So now
Mm-hmm.
the age barrier is gone. So what I suggest is, if you are 30 plus, it's better to be on the safer side. Means you have to understand that you are under risk. So 30 plus, we have to keep checking your sugars. I'll tell you how to go about that later.
Okay.
So that is first thing, age. Second thing is obesity. Come
Mm.
to obesity, when your visceral fat and your fat is more, then you are more prone to become a diabetic. And family history, of course, like if
Yeah.
parents have the diabetes, then there are risk of getting diabetes. But of course, now we can't say they have given will to us of diabetes, because our lifestyle is more worse than that risk factor.
No, no, you're right. And when you say obesity, so my antennas just stand because
Yes.
it's like really become an epidemic, the
Exactly.
next
So
pandemic.
even
Huh.
overweight, obesity, that also plays a
Mm.
very risk factor. Then pre-diabetes. Pre-diabetes is one more risk factor. People who
Mm.
are diagnosed as pre-diabetes, there are chances for them to become diabetic very fast.
Okay.
So that also we need to focus on that point.
So when you say very fast, how soon does it?
That we won't know. Like we can't
There's
say
no
exactly.
tentative.
They
Uh-huh.
can, they may not, but the pre-diabetes are huge risk factors for becoming a diabetic.
Okay.
So that is one thing. And sedentary lifestyle, smoking,
Hmm.
alcohol,
Hmm.
other habits. So all these are more risk factors. And stress plays a very
Right.
important role nowadays. You can't see a person who is completely relaxed. Very rarely we see. So risk factor is one more, stress factor is the.
I just want to ask you one question there, Doctor. See, when you say stress, I mean, I really didn't believe that stress could cause that much of
Mm.
issues in our bodies. But how do we cope with that? Like,
See,
it's.
first we have to understand how stress
Hmm.
makes your body
Yes,
become.
yes.
Stress, okay, everybody says stress, but how it happens? See, for example, if I give you steroids,
Hmm.
tablets every day, small dosage, what will happen to your body? It has its own side effects.
Yeah,
All your sugars can go high, other parameters, every system gets affected.
right.
So, what happens when you take stress? Same thing happens in your body. Your body is, to combat that, it is releasing little bit of corticosteroids
Okay.
naturally in your body. So everywhere, every time you take stress, little bit of steroids is releasing. So
Mm-hmm.
that's why your sugars can go high and all
Okay.
other parameters can go high. So stress plays a very important role. So how to combat stress? Yes, it's a huge open discussion
Yeah,
for
I think
that.
we need another episode for
Yeah,
that.
for stress management, we need a one more thing, because there are a lot of things to understand. To manage mind is not so easy.
True.
So, but it is not impossible also. So if you do some few things, then we can definitely plan that.
All right. Yeah, definitely. We would like to have that conversation. Now, one more thing, Doctor, you mentioned about smoking.
Hmm.
Now, I do see a lot of people, instead of smoking, to quit smoking, they
Hmm.
start vaping.
Hmm.
So, what are your thoughts about vaping and smoking?
You're
Like, do
asking
you,
which poison is better?
yeah, so both are poisons. Yeah, but people don't seem to understand that, I
No, no.
guess.
Vaping is not advisable.
Mm-hmm.
So even though the content is little different from what to do for smoking,
Hmm.
but still it's a smoke you're
Hmm.
taking inside and you're living out. So I think better to quit.
Avoid.
Yeah, there are a lot of ways to quit smoking also.
But for example, some people when they are smoking, they're trying their best, but they're not able to. So how often do you think? I know it's not okay to smoke,
Yeah.
but I want to understand how often do you think it's okay for them to smoke?
See, if you ask me like that,
Hmm.
my reaction will be, you'll have 100 reason why not to quit, but you need only one reason to quit.
Yeah.
That should be more of a emotional reason, a strong emotional reason, not about health. If I tell you your health is going to get spoiled, nobody will listen, because they dekha jayega. Let us see when
Hmm.
it happens. But the problem here is, it's you need a more strong one emotional reason. I've seen people who are chain smokers quit
Mm-hmm.
in one shot.
Oh, that's
One
amazing.
reason, one emotional reason, not about health, because health is always a second priority. Whatever you say, okay, I'm very health conscious, but still it is a second
Ah,
priority. First priority is your job, family, all those things are first priority.
right.
So health, we if you tell health become better,
Hmm.
no, it's more of a emotional reason that is going to help us to quit smoking. So we have to find out what is that strong emotional reason.
See, I think that is really a life skill again that he's talking about. I was not agreeing to this earlier whenever I've heard about it. But yeah, we can be very fancy and we can say that, we are very health conscious, but that's not the fact. I think something else that inspires us and compels us to stop doing things we are doing
Correct.
would be a good time to think about,
Yes,
good topic
exactly.
to think about.
Yes, maybe
All
that
right.
also we can have one more talk
Yeah, let's keep it as a third episode.
about.
We'll keep bringing Dr. Sudarshan back to you, because for me personally, I do have a lot of anxiety, stress. I'm on medication, and for me, doctors like these really play a huge role, because he's, like I said, I'm repeating it again, educating us and patiently listening to our problems. That's very important. So thank you, doctor, for joining us,
Thank you.
and please do come back, keep
Sure,
coming.
sure, sure, sure.
Okay.
Mm.
So why does, I think we've discussed
Okay.
why it,
So, why diabetes comes? Good question. There are only two reasons. I'm talking about type 2 diabetes, to be
Mhm.
very frank. So, don't go to type 1 and GDM. I'm talking about type 2 diabetes. Why diabetes comes? Two reasons. One, insulin deficiency. Two, insulin resistance. I think you people would have known about insulin by this time. So, you would have educated about that. So, insulin deficiency means decreased production of insulin in our body. Insulin resistance means insulin is there but it's not doing its work. So here there are the two reasons. But in type 2 diabetes, the most stronger reason is resistance, because production will be happening somewhere in your body. Insulin will be there. But the problem is the insulin is there is not working accordingly. So why that happens? Why this insulin resistance happens? To understand that, let us understand the work of insulin first. Insulin works like a distributor. Whenever we eat food, food is digested and sugar goes to your blood. Once the sugar goes to your blood, insulin takes it and start distributing to all the cells in your body. Once the distribution is over, then only your sugar level comes down. This is normal work of insulin. But what happens here in diabetes is the distribution is not happening properly. Why? Let me give one small example. Imagine the room where you are sitting now is one cell. You are sitting inside a cell. If you have to come inside, the door has to be open. Same way, each cell has a door called insulin receptors that has to be open. So what happens whenever we eat food, the sugar in the blood is going to inside the cell through the door. Okay, so whenever we eat food, it is digested, sugar goes to the blood, and the sugar from the blood goes to the cell through the door of insulin receptors. Now what happens here is the door gets closed. Once the door is closed, outside in the blood, insulin is there, sugar is there, not able to go inside the cell, your sugar level rises in your blood. It accumulates in your sugar level will accumulated in the blood and it start rising. So that's how your sugar level goes up, because your insulin receptors are blocked. So why that block happens? The first reason is, as I told you earlier, stress plays a very important role. So you undergo stress anytime, the door gets closed. The second reason is sedentary lifestyle, not much activity, the door gets closed. The third reason is fat cells. Here comes our overweight and obesity, and not that, even a person who is not looking fat also have fat cells. So those goes and blocks the door. And fourth is alcohol, and fifth is smoking. So all these will get help you to close the door, and then your sugar level is not going to go down because of the receptors is blocked. That's how your sugar level goes up. So this is how internally it works. I try to put it in more common terms, so I'm not trying to use more medical terms here, so
Mhm.
that you will understand easily. Hope you got the
Yeah,
point.
yeah, definitely. I think it was really simplified and important to know this aspect. Now, doctor, also I've heard there are a lot of complications, of type 2 diabetes. And mostly people think that they are very healthy, because I have personally seen a lot of people, once they cross the age of 50, 55, I think the kidney stops functioning. God knows what happens. So I don't know those details. But could you please explain to us what could possibly be the complications?
The complication of diabetes is very important, because one thing what we have to understand is, once the complication happens, you can't reverse it.
That
So
is really sad.
that's
My
really
God.
scary, yes, but it's really motivating for me, if you ask
Yeah.
me.
Oh, wow. Yes.
Because prevention is always better and cheaper than cure, according to me, right? So we have to prevent those complications. That's what we need to do. So what happens is, see, when the sugar goes high, your internal organs, it can be anything, like your kidney, your heart, your eyes, your nerves, or any name the part of the body, it can damage. So once the sugar goes high, the damage starts in a microscopic level. So we won't even know. People will think even with 600, 500 sugars, they are very happy. I don't have any problem. Why I have to do something? But inside, the damage starts happening in a microscopic level. By the time you understand and realize and get the symptom, it will become macroscopic level. So that is irreversible stage. So once the damage is happened, it can't be reversed. So that's why we struggle so much to prevent those damages. So our goal is to prevent those damages caused by diabetes. So how to do that? Bring down your sugars to normal level, maintain it. If you bring down your sugars to normal level and if you start maintaining it, then you will be almost like a normal person without diabetes. Your risk factors will be almost nil. So our goal is to prevent those. So let us take a pledge that we are going to prevent all these diseases. So once it comes, then you are nowhere. So let
Yeah.
us take a pledge so that we can prevent all these complications by control your sugars and maintaining. Whether you're taking medicine, whether you're taking insulin, or whether you're doing only with your lifestyle, that doesn't matter. But if you control your sugars, your body is going to cooperate with you. And I've seen people who are 40, 50 years of diabetes. I'm talking about if diagnosed of diabetes of 30, 40 years, and they're leading happy life without any complications by maintaining their sugars. So anybody can do this. Only thing is we need to focus on our glycemic control strictly.
Okay, doctor. And see, when you say medicines, a lot of people think that by taking medicine, that means they are free of diabetes, because that is a misconception that even I had. Now, the moment you stop taking medication, the HbA1c goes higher, right? So, don't you think people who are under the impression that if their sugar levels have come down and they're ignoring the fact that they are taking tablets, they are absolutely fine, and then they start eating, drinking, alcohol, everything they start. So, what do you have to say about that?
See, one, there is a myth. People who really, I've seen many people saying that they don't want to start medicine. Why? Because once you start, you have to take lifelong. This is a big myth people are having. So people escape taking medicines and they are not aware of how important the controlling sugar is. So our main goal is to controlling sugar first, because people say no, no, if I take medicines, kidney damage will happen, heart will get problem,
Yeah.
liver will get problem, so I won't take medicine. But the important thing what you have to understand is, more than the risk factor of your tablets, the sugar high content in your blood are going to damage your kidney and liver. So this we have forgotten to think about this. So you have to understand that first controlling sugar is much more important than your medications. So the tablets whatever you're taking may not have any that much side effects. So if you're taking antibiotics, painkillers, all those things, yes, I agree. But these are medicines which are made for lifetime medicines. So there is nothing to worry to take tablets. Please don't worry. And once you take tablets, it's not that you have to take lifelong. If you plan your lifestyle properly, if you plan a proper process, definitely we can start reducing medicines and we can stop it even. It is possible to stop tablets.
Okay, doctor. So, my question is that a lot of people, they think that if they are, now let me give you an example.
Mm,
Now there's Mr. A.
mm.
He has a high sugar, but since he's taking tablets, his sugar levels come down. So earlier, if he would
Ah,
have an ice cream, it would be probably post the ice cream 200, 250. But now that he's on medication, maybe his sugars post the meal is 140, and he feels very happy that he's cured. So I mean,
oh, like that. I
that
got it. I got it
yeah,
now.
yeah, yeah.
Actually, controlling sugar is not curing diabetes. You can't cure diabetes. Diabetes is not a disease, it is a lifestyle disorder. So you can't cure diabetes. If somebody says, I'm going to cure your diabetes, hold on. No, not possible. So you'll be diabetic for lifetime. It's like a feather to your throne. Once you get this, it will be there. So you can't change that. Only thing is, what is the main agenda of this treatment is you have to control your sugars and maintain it and prevent complications. So medicine taking is not okay. As you asked me, like when I take some people I've seen, I take on jamun, gulab jamun, I increase 2 units of insulin.
Yeah, yeah, yeah.
So
That's
I
also.
take the, so it's not the way it is. For us, it's more of controlling sugars with your proper lifestyle, and then reducing your insulin and stopping it one day, reducing your medicine and stopping it one day, and maintain it with your lifestyle. There is something called reversal of diabetes nowadays, very common term we people will be listening to. Actually, I don't agree with the term reversal of diabetes, because reversal, the definition means reducing medicine and stopping it is called reversal, but it gives a different definition for a common person thinking that I'm going to get cured of diabetes. So rather telling reversal, remission is a better word for me. So remission means you're reducing your tablets and stop it one day. Your HbA1c is controlled, your sugars are under control without medicine. So that should be our focus. Still, you will be a diabetic. Still, you have to maintain your lifestyle. So taking tablets extra, controlling sugars, I can eat anything. Well, of course you can eat anything, but what is your long-term goal? It is not. I'm not focusing on immediate goals, not short-term goals. I'm trying to focus on your health after 10 years down the line, 20 years down the line, 30 years down the line. What will be your health? So we should focus on a long term. Now we will be young, healthy, and also you won't feel anything. But once the age passes, so you need, it's really important to be healthy. So we have to focus on long term goal. So after 30 years of diabetes, if you don't have any complication of diabetes, that you're a winner there.
Amazing. Thanks for sharing that, doctor. Just a few more questions I'll ask you. So, now when you say that diabetes can go into remission and we stop the tablets, will the person still have the risk of the organs getting affected?
No. See, the risk of organs getting affected only when your sugars goes high. So
Got
if
it.
your sugars are under control, if you can maintain with your lifestyle alone, so definitely you can be out of risk factors. See, how we are going to stop medicine is not one day, 2 day thing. It is not that okay, today you come, tomorrow we stop. No, it's not possible like that. It's more like a long process. You have to have patience. You have to, your body has to respond. We have to have a plan according to your lifestyle. We have to plan your lifestyle. We implement it slowly. We are going to reduce medicine. How it happens is just by opening your doors of your cells. So
Got
if you start opening the doors of your cells, your receptors blockage be cleared, the medicines requirement comes down. So that is the concept what we have to focus on. But lifestyle plays a very, very important role. You will be a diabetic even if you stop medicine. If you leave everything, your sugar will again go high. Possibilities are there. So once we stop medicine, the real work starts there. How to maintain it.
Okay, doctor, got it. Now, I've heard HbA1c is the aggregate of 3 months of blood
Hmm,
sugar,
hmm,
right?
hmm.
Now, when people go for tests the previous night, they don't eat sweets, or for 2 days, they don't eat sweets, thinking that, oh my God, if I eat it, then it'll be high. So, is that true?
HbA1c won't get. That's why we do HbA1c. If you do fasting postprandial alone, so you can cheat us. But that's why we do HbA1c where you can't cheat
Yeah,
us.
yeah, there are a lot of
So
cheaters I've
I've,
met.
I've seen people, their fasting postprandial will be fair, but HbA1c would have gone up. They say, no, no, I was doing everything. They will know that only yesterday they did the dieting part. And they've
Oh,
forgotten that HbA1c will catch you.
exactly. And they don't know. Still, every time they visit you, they give you the same reason.
Exactly.
A very important point to be noted,
See,
doctor. Thank you.
some people say, no,
Mm,
no, when I get sugar control, I'll come and meet doctor. Well,
right.
no, why? When you're good, when everything is fine, even if you don't meet, that's fine.
Yeah.
When sugars are not under control, only you have to come and meet us. You need our help that time only. So not when your sugars are under control. See, no need to impress us with your numbers.
Yeah.
We want you to be healthy.
Right, very true. And doctor, I just want to ask you this about exercise and food.
Hmm.
Now, the moment people understand they have sugar, they go into CrossFit and strength training, this training, that training. Then they do it for 2 days, and after that, it's forgotten.
Hmm.
So, what is the best form of exercise, and does it really work?
Exercise plays a very, 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 very important role.
Okay.
So many worries still not, still less I can say, because without exercise you can't open the doors of yourself. If you want to control your sugars for long term, if you want to reduce your medicine, if you want to stop your medicine, exercise plays a very important role. Simple exercise like half an hour to 45 minutes of walking will do the justice. And nowadays I'm seeing very good results after 15 minutes of walking after meal. So that
Immediately after meal?
immediately after meal, after
Okay.
your lunch, breakfast, and dinner. So go for one 10 to 15 minutes of quick walk. That is going to help us a lot.
But my tummy, like I'm giving you my
Hmm.
example, when I eat my meal and walk, my tummy starts paining if I walk
Yeah,
immediately.
go slowly. It's not that go for a brisk walk, just
Oh,
go for a stroll. So that
okay.
is going to help us. So the walking is the simplest and easiest form of exercise that you can follow on. So, and of course, there are a lot of other things. See, for me, it is more like activity. You do whatever you like. Some people doesn't like walking. It's fine. Choose your own. So either walking, or you go for a Zumba, you go for swimming, go for a play, you go for a gym. Yes, go for it. And gym definitely is going to help you because of your strength training. Your muscle mass is going to become better. So once the age passes, your muscle mass will be more stronger. If you do go to gym, it will become better. So I recommend gym for this, for diabetes.
Got it. And what about food? I mean, of course, we are not going to discuss the entire
Yeah,
diet plan, but some basics you would
yeah,
want the citizens to keep in
correct.
mind.
See, food is more like I can't give a generalized opinion about food because I don't believe in giving that, because each person will have their own priorities. So what I prefer is to get to know the person's lifestyle and start changing according to their comfort zone. Suppose if I tell you, if you don't like idli every day, if I tell you eat idli every day, two idlis every day, it's not possible for you. Maybe in the Josh initially we do. Later, if you don't like, we'll leave it. Then we lose track. But of course, generalizedly, I can say what and all we can do. First thing, people think sugar is more dangerous and jaggery is safe.
Yeah.
That's a myth again, because both come from same sugar cane. So sugar and jaggery has only one difference, that is color.
Oh,
So please avoid sugar and jaggery in your coffee tea. That's the biggest, what to say. I can say it's the biggest
poison.
help you are going to
Oh,
do to your
acha.
body.
No, so you're saying that now by chance people who want to consume little sugar, we might as well consume white sugar than going for brown color.
Only difference is the minerals will be more in jaggery. That's all.
Got it. And
So
stevia, is it good?
stevia is okay. See, actually, coffee tea originally is made of no sugar, no jaggery. If you go to big hotels and if you go abroad, and all, they won't put sugar in it. They'll
Got
give you
it.
separately for you to drink. We
Yeah.
have Indianized it to match our taste buds. So I
Yeah.
think coffee tea originally is without sugar, and once you start drinking it, definitely you're going to enjoy it. So first thing is sugar cut off in your coffee tea. Once in a while, sweets chalta hai, cheating we can do, but sugar coffee tea is no, strictly.
Once in a way, matlab kitni bari?
That depends on your sugars.
Okay.
So
Once a week?
generally, yeah, so generally we can. So any functions, parties, fine.
Hmm.
So that's one thing, that part.
Okay.
Coming to main course meal. So rice again, I'm not against rice. I feel to a South Indian, especially if you're a South Indian and if you're watching this, if I say stop rice, I'll be a villain. So, and it's a crime. So you can't stop rice. So there is nothing banned in diabetes as such, but you should understand how to eat. So portion control and when to eat, when to avoid rice. So that is very important. See, depending on your sugar level and what medications you're taking, maybe we can plan accordingly. Maybe afternoon times you can have little rice, night time we can avoid rice. That one thing you can do. So, and more than that, millets and whole grain. Whole grains are very good. So please start using whole grain cereals like millets, your quinoa, your ragi, and your dalia. All those things you can start using more. Brown rice, not red rice, brown rice. All these are going to help us a lot to control your sugars because there's all glycemic index is little low. So coming to your veggies you have to eat more. Potato once in a while. Other than that, eat all kinds of vegetables and salads. So that is going to help us. Coming to fruit, juice, please avoid. So you can have directly, you can eat fruit, restricting according to your sugar levels. Your doctor will recommend. And juices strictly no. Even if you don't put sugar, no. Why? Because fruit is a complex carbohydrate with lot of fiber. When you crush it, it will become a simple sugars and fiber is lost. Even if you don't put sugar, you're drinking a sugar filled with the water of sugar filled with completely sugars.
Oh,
So water filled with sugars. So
Mhm.
that's what it is. So please avoid juices and aerated drinks. So if you want to drink, you can drink buttermilk or barley water, something like
And dark chocolate is okay, no? Amul dark chocolate.
that. So once in a while, everything is okay, not on a everyday basis.
Got it.
So
Yeah.
once in a while, even you can have a normal sweet once in a while. That's fine,
Uh,
but not on a daily basis.
Got it. And I think we've spoken about diagnosis and
Huh.
treatment.
Yeah, diagnosis. Yeah, last one thing for non-vegetarians, I want to say something.
Yeah, sure, sure.
So because there will be pure non-vegetarians like me.
Like me also.
So chicken, fish, egg is fine. Red meat once in a while, so that you can plan. That's fine.
Got
So
it.
now, as you asked me, diagnosis. So how to check, how to when to check all those things. If you are not a diabetic, so first you need to go at least year after 30 years. Yearly once complete annual checkup is a must for everyone, because life will give surprises. Because most of the people diagnosis of diabetes is incidental. Nobody will have a symptom. Very rarely
So
we have
true.
symptom.
Yeah.
So they went to something, they checked the sugar, sugars were high, they didn't even know they're diabetic. So these are things. So it's always, let us avoid those surprises. Yearly once you check, at least you'll keep a watch and you'll know where you are. So that yearly once, if you're not a diabetic, please check. If you're a diabetic, then it's a different terms. If you're a diabetic, so okay, what to check? So
Hmm.
yearly checkup, that everything will be included. But now main for diabetes to know, you have to check your HbA1c, fasting sugars and postprandial sugars, and all other parameters like your kidney cholesterols, your lipid profiles, your liver function, thyroid, vitamin D. This is very important. Vitamin D and B12 plays a very important role in diabetes. So these are the things we need to keep a check yearly once, even if you're a diabetic. So if you're
Okay.
not, if you're a diabetic, then what are when to do the tests? So what I suggest is to monitoring plays a very important role in diabetes. So monitoring means, if you have a glucometer at home, that will be amazing. So weekly once you can check at home before food and after food, maybe 1 week morning, 1 week afternoon, 1 week night, to keep a track.
Do you suggest any particular brand, doctor?
I don't want to promote any brand here, but there are
No,
a
the
lot of brands.
trustworthy.
Yeah, AccuCheck
Huh.
is good, One
Hmm.
Touch is good. So there are a lot of brands which are
Got it.
really
But
good.
these are like well known.
Very well known brands.
Got it.
Morpen is there. So there are other things are there.
Huh.
So weekly once checking is very important, and 3 months once, please, whatever it may come, once in 3 months, please check your HbA1c. This is very important.
Yeah.
And 3 months once, please go meet your doctor. So doctors are there to help you. Please go and meet your doctors 3 months once if you're a diabetic, because that is going to help you to prevent a lot of things, complications in future. So HbA1c should be below 7, and if you maintain it, then you're almost out of risk. So please meet your doctor 3 months once, HbA1c 3 months once, and once in a year complete check, and your eye check and all those things we can, ECG and echo, routine things we can get it done.
Got it. And treatment, obviously, we need to meet the doctor and
Yes.
get it
So
treated.
for your treatment, what medications you are on, what medication has to be done. There are a lot of new medications have come now, which is really helpful for us, especially with your, if you're diabetes with obesity. Definitely, there are a lot of new medications are there, which is really helpful. Please meet your doctor, and they're going to suggest you about this.
Got it. And doctor, before we conclude, before I tell our viewers where can they meet you and how can they get in touch with you, could you please give one message to our senior citizens and one message to the rest of the citizens of our country?
Younger generations, fine.
Yeah.
Senior citizens, good. When you're retired, I feel you're in your golden period of your life, because you have finished all your commitments, all financial commitments, and your kids will be settled, and you no need to go to work. You're financially okay, so you have to enjoy your life. So please make sure that you rock it, because that's the way to live. Like you can do whatever you want to do, whatever you missed all these years when you're working, please do it. So because when many people think after retirement life is done, no, life starts there. That's your start of your life. So please don't get into that zone where, okay, nothing has to be done, everything is over. No. So please do whatever you missed all this year. Some passion you would have left it because for your commitments. Restart. What is there to learn music at that age? What is there to go for a trekking, depending on your physical condition? So go for trips, go for holidays, go to temple, do some social work. Whatever your passion is, please do it, because once you sit at home and think you're done, your health is going to deteriorate. So
Right.
never ever think your life is over. Your life starts there. So of course, in senior citizens, when you're little aged, we have restriction will be there. So depending on your sugars, depending on your lifestyle, depending on your pattern of living and what medications you are taking, you can plan your lifestyle accordingly. And maybe your doctor will help you to guide you through that. But definitely checking once in 3 months HbA1c is a must. Coming to younger generations, stress, sedentary lifestyle. These two are our killers. So you need to manage your stress, and you have to be active, and of course alcohol and smoking, these two things has to be taken seriously. So to manage things, how to quit or how to reduce, you plan it your life. So if you really focus, if you really plan, and definitely we can be very healthy and have people. See, we have in my experience of 25 years in this field, have seen many people. We have stopped medications. They're maintaining their sugars without any complications. They're happening, leading a very happy life. And I can't say I stopped tablet. That will be a wrong thing. They made me to stop that because that is their commitment. So I have the eldest person I have stopped tablet is 76 years.
Wow, really?
76 years I've stopped tablet.
Mm-hmm.
So I was I was surprised to be very frank, because I was thinking, okay, I can start tablet in younger group because their body is responding.
Yeah,
Age is just a number, guys. So even if you're old, we can plan that. It is not a problem.
amazing.
It is not a big deal. So we have to stop that. So because there shows that their commitment. It's not nothing to do with me. Their commitment, their consistency is what has helped. Consistency is the key. Managing your life, your lifestyle consistently is the key. So go for it, be healthy, and manage your sugars, control your sugars, maintain it, and then we can plan to reduce your medications. But don't stop tablets on your own. Don't reduce medications on your own, please. That will lead into different things. Please consult your doctor, ask them what you can do. No, even if you go to a doctor with HbA1c 5.5, what doctor will do? They will reduce your dosage, right?
Yeah.
So you focus on your goals, you plan your goals, you put a goal. Okay, this month my HbA1c should be this much. After 3 months, I'll reach here. Plan for it. It's just like a planning your routine. So it has to become a habit. No need to get motivated. It has to become like a habit. It has to become a lifestyle. Like when you get up, do you need a motivation to brush your teeth? Directly you go now, right? So somebody has
Yeah.
to motivate you, go brush your teeth, because it has become a habit for you. Same way, all these things should become a habit. Then no need to do all these motivational talks and so you automatically keep doing it.
Yeah,
So
very true, very true. And doctor, before we conclude, I'd like for you to let them know where can they get in touch with you, how can they consult you.
okay, see, I'm practicing in Vruksho Clinic, which is in Henno Road, Bhairati Cross. The phone number and all, I'll give it to
We'll
you.
put it in the description
Yes,
box
so you
below.
can contact them, and they will arrange for the appointment. You can come down if you are close by, or even a video consultation we can plan. If you are
All
far
right.
away, we can do that.
Great. Thank you so much.
Thank you.
And I'm not going to let you go so easily because let me tell you guys, I do follow him on Instagram and he has an amazing voice. So I would request you to give our viewers a message through some nice song. Let's have some fun here.
Okay, one song is there where you can manage your stress listening to that song. So if you follow that, I think your stress management will be very easy. So let me give it a try. So
Okay, then the stage is yours, doctor, and all of you enjoy the song. We'll be back again to address your questions and ensure that our nation is taken care of and we are living our best life. So the stage is all yours, doctor.
thank you.
And thank you so much for your time.
Thank you for inviting me. It was a pleasure, because spreading awareness is always, I feel it is very important. People should know what is happening, how they have to manage. Or this, you're doing a great job.
Thank
So
you,
great
Dr. Thanks.
initiative. So thank you so much for inviting me.
Thank you. So let's listen to the song.
हंसते गाते जहां से गुजर, दुनिया की तू परवाह न कर, मुस्कुराते हुए दिन बिताना, यहाँ कल क्या हो किसने जाना, जिंदगी एक सफर ए सुहाना, यहाँ कल क्या हो किसने जाना. So, forget about everything, live today, be happy, be healthy. Thank you very much.